This is a condition which is known as attention deficit hyperactivity disorder. We also sometimes speak of ADD, which is attention deficit disorder, if the hyperactivity is less of a feature. We regard it as a spectrum, so this can range from the child who is an extreme daydreamer and loses focus and concentration, right through to the very hyperactive and very impulsive child who just simply doesn't have breaks. In medicine, we often like to confirm a diagnosis by doing a blood test or an X-ray or some other investigation. But with ADHD, the diagnosis is actually made on history. So the history starts at a very young age. Most people are actually born with this problem. And then later on, we rely on reports from primary school teachers, nursery school teachers, and also from the parents. Sometimes we get information from therapists, like occupational therapists or speech therapists. This is often presented either in the form of a verbal history or in the form of a written history, where we make use of a range of questionnaires. And probably the best known one is the Conners questionnaire, which explores activity within a group, activity as an individual, and then also the response of a child's peers. It's very important to have a holistic approach. In other words, the diagnosis should be 100% correct. There should be an opportunity to explore therapies of any kind, whatever is necessary: speech therapy, occupational therapy, sometimes psychotherapy. And only once all the options and the comorbidities have been explored, then one might have to resort to a combination of medication and whatever else is required.